Welcome to the online tutorial classes for Vidya Bhavan High Secondary School. I am Megha ma'am and this class is for class 12 and the chapter what I will discuss today is common deficiency diseases in India. This part is part 5. In before 4 parts I have already discussed about the PEM and VAD, but in this chapter, in this part I will discuss about the anemia. Okay, so what is anemia? Anemia is a deficiency disease where the hemoglobin content is less in our body fluid, in blood. So the hemoglobin content, hemoglobin decreases due to the various reasons. That can be for some micronutrients, for some vitamins, for irons, etc. So anemia is a disease where hemoglobin level is low. The causes of it are for the deficiency of various vitamins like folic acid, B12, C, and also minerals like iron deficiency anemia. It's a very common. Okay, so now I'm going to the classifications of the anemia. Okay, the classifications. The first type in this classification is the nutritional anemia. Nutritional anemia, where any nutrient loss is leading to the anemia. That can be of some of type like the first one, the following types are, the first one can be microcytic hypochromic anemia. It occurs due to the deficiency of the iron. Okay. The second one can be megaloblastic or macrocytic anemia. The reason of this is can be folic acid deficiency. Okay, and also along with the B12. Okay, so it is mainly the deficiency for the vitamins. Now the third can be dimorphic anemia. The reason behind this is always B12. Okay. The fourth can be normocytic hypochromic anemia. The reason is mainly vitamin C deficiency. Okay. So these are the nutritional anemia. Now we are coming to the hemolytic anemia. Okay. The second is hemolytic. Okay. Hemolytic anemia. The hem means hemoglobin and the lytic word came from the lysis. Lysis means breakdown. So breakdown of hemoglobin is called hemolytic anemia. The causes can be the blood transfusion, actually the problematic blood transfusion, or the when the blood gets mixed, the various types of blood, if the various group of blood get mixed, then the blood transfusion may lead to the hemolytic anemia, and also for the snake bites, for the malaria, etc. are the main causes of it. Now, the hemorrhagic anemia. So the next one is hemorrhagic anemia. So the meaning of the hemorrhage is excessive blood loss. So it can be caused by many of things, like any accidents, like any diseases, etc. The next is genetic. Okay, the genetic anemia. The causes of the genetic anemia can be the thalassemia, okay, or the sickle cell. And the next, I'm just erasing. The next one is aplastic anemia. When aplastic anemia is something when the lifespan of 120 days of an RBC get decreases. Okay, the normal lifespan is 120 days of an RBC, but when it get decreases, then the aplastic anemia forms. The next is iron deficiency. When there is any deficiency diseases due to the iron, due to the malabsorption of the iron or anything, or lowering the consumption of the iron, so it leads to the iron deficiency anemia. It is mainly seen in the pregnant woman, also in adolescents, also in the babies. Okay. Consequence of the anemia. Okay. As hemoglobin carries the oxygen for our cells, so if the anemia occurs, so the body oxygen transmission get hampered, and also the cells, as the cells doesn't consume the oxygen properly, doesn't get the oxygen properly, they become pale, and we feel some tiredness, and also the lower walk capacity can be seen. So the consequences, like for the pregnant woman, it can lead to the 20% of maternal death, also hampers physical and cognitive activity. For the children, low birth weight, infection, okay, and also for the adolescents, they are lowering school performance. So these are the very common consequences of the anemia. Now I am coming to the signs and the symptoms of the anemia. The very common signs and symptoms are firstly paleness. It is seen to the children and also in the mother and the pregnant woman. Next is swelling of feet due to edema. Edema forms, so the swelling of the extremities can be seen. Then third is koilonchia. Koilonchia means the nails and the fingers became papery thin and malformation of the nail form. The next is reduction walk capacity, also breathlessness. The next is induced immunity, also the improper cognitive development, also maternal and perinatal mortality. So these are the main signs and symptoms of the anemia. So in this class we have discussed about the signs and symptoms and the different types of the anemia. In the next class we will discuss about the causes, the treatment and the supplementation. Till then, thank you.